month of March. And when it comes to March, it means it's Women's History Month. Hence, throughout the month, we are going to highlight the many accomplishments of women. Today, however, we're going to focus on women's health. Joining us to discuss just that is Dr. Mina Merholm back here on the Live Zone. Dr. Merholm, always good to see you, sir. Welcome back to the show.
Likewise, Guy. Great to see you. Thank you for having me.
You recently wrote a chapter in the book known as Women's Pearls, which pays homage to women, if you will, and it focuses on all things surrounding the health of women. Do tell, sir.
Absolutely, Guy. This is a wonderful opportunity to discuss this book written by or co edited by one of my great friends and mentors, Dr. Peggy Carinas. Shout out to her, who's mentored me for many years. And the impetus for this book is really around the fact that women's mental health issues are oftentimes overlooked, misunderstood, and the context there is so key, especially as we're celebrating women's history at this time and celebrating their contributions and how they impact and how their health is impacted in general. It's so key for us to be able to understand each disorder and each struggle that a woman can go through from puberty to pregnancy throughout the course of her life. And in order to do that, we need to have special attention paid. So that's why I was grateful to be a part of this wonderful textbook.
Yeah, I would argue that women in most cases happen to be the cornerstone of the family. I mean, without
Absolutely.
them, I got to tell you, I mean, I can't speak for all guys, but dear God, they do so much. And so, with that being said, I'm curious from the mental health perspective, what are we missing here? What are they dealing with, and how can we as a society assist them?
You're absolutely right, Guy. There's so much being sort of expected between the workplace and the home, and this is part of the reason why we see the statistics in mental health that women are 4 times more likely to attempt suicide than men, and twice as likely to experience anxiety symptoms and depression symptoms. And oftentimes, one of the difficulties here is that there's this expectation that women just kind of carry more of the load and be that cornerstone and do so in silence. And they get used to being this sort of high functioning anxiety and depression and doing it all essentially. And so, we as a society need to be able to take time and say, we have to better recognize and support women who are struggling in order to best put them in a position to thrive and do well and continue to be that cornerstone for us.
Well, I'm so glad you touched on that, Dr. Merhoma. I'm thinking about years past, and let's just jump back, let's say, to the '80s, where perhaps this wasn't even a topic of discussion. Fast forward to 2025, and now we're bringing more awareness to this. Can you talk about the evolution of making sure that we address this, and how far we have come, and how far perhaps we need to go?
We've come a long way, and I think one of the most important ways that we've come this way is that where the conversation has been, the research dollars has flowed in a direction where more of that awareness around diagnosis, treatment, support has really grown in an exponential way over the years. And part of that reason has been because there was a, if you remember in the Super Bowl, there was a wonderful Nike women's sports ad that just sort of took center stage because the narrative has shifted and the advocacy for women's mental health and women's health in general has changed because we're realizing that this is not a place where we continue to do business as usual. We need to be able to advocate better. We need to be able to have, whether it's maternal mortality around pregnancy or whether it's things like suicide prevention, in order for us to have a change in the outcome, we have to have a change in the conversation, which thankfully that's been happening over the past couple of decades.
Can we address diagnosis? And what I mean by that is so many times it can be overlooked. Let's say with regard to women perhaps suffering from mental health issues. With that being said, what are some of the indicators, if you will, or things that we should look for and or that approach in order to make sure that it's addressed?
Yeah, absolutely. Similar, because we were saying here that there's often this expectation to just kind of carry on and endure. I advise my female patients, I do consults every day in the hospital on women who just gave birth or who are pregnant, and ask them to think about 4 Ds: the duration, the depth, the danger, and the duty. How these things are impacting your daily function, how long it's been going on, how much it's getting in the way of the things that you need to do and that you love to do. Because oftentimes we can feel severe symptoms that are debilitating, but because they've been going on for so long, on average, it takes over 11 years from the time a person begins to have symptoms to the time they actually connect to treatment. So, one of the conversations I have with women is to be that advocate for yourself, to be able to say, I know I've been experiencing this for a while, and it's getting in the way of what I need to do. And this is not just something that I need to continue to put up with, but rather it's something that I need to be able to find what is an appropriate treatment for this. How do I have a diagnostic process and not to be brushed off or brushed away, but actually seek the appropriate treatment for it.
Very well said. Yet again, we have been speaking with Dr. Mina Merholm. Truly appreciate you joining us. Yet again, that chapter that you contributed in the book Women's Pearls is available now at your favorite bookstore and or any location to which you can purchase a book. Dr. Merhome, always good to see you, sir. Thank you so much for coming on the show.
Thank you so much, Guy. Thank you. Great to see you.
Take a quick break and we'll be right back.